So we look at the adoption of government-led homestead gardening program in Ethiopia. These types of programs have become extremely popular way of addressing micronutrient deficiencies and low intakes of fruits and vegetables. The idea was pioneered by Helen Keller International in Bangladesh in the 1980s. These gardens are areas where families grow fruits and vegetables for their own consumption to address their nutritional gaps and meet requirements. Today, these types of programs are implemented in a number of countries in Asia and in Africa, either by the Helen Keller International or other NGOs. But there are a couple of evidence gaps that we try to look into in this paper in the context of Ethiopia. First of all, despite the popularity, there's actually surprisingly few rigorous home garden evaluations. The exception is this study done in Burkina Faso by our IFPRI colleagues Diana Olney and others, and they found that this Helen Keller International-led program led to improvements in anemia rates, wasting, and diarrhea among young children. But there remains questions about external validity. Water access seems to be extremely important for these programs to function well. And the original programs were implemented in Asia, where rainfall levels are much higher and small-scale irrigation much more widespread compared to many African countries. And interestingly, the Burkina Faso evaluations explicitly focused on areas that have water access during the dry season. The other issue is scalability. Virtually all of these programs have been implemented by NGOs, very capable NGOs. So can governments really make these work too with the public servants that they have? What about food markets then? Food markets is something that we economists think that maybe these are important as well. And especially the question that often we have is diversifying homestead production really necessary for improving dietary quality, especially in areas that have good market access? And the implicit assumption in these programs seems to be that food markets are absent or missing or do not function well. But there is also anecdotal evidence coming from Ethiopia where I discuss with NGOs. They say that many of these households start these homestead garden programs, homestead gardens, with the idea of getting cash income. So they live close to the markets and they bring the foods to these markets to get access to cash. So that's something to keep in mind as well. In Ethiopia, which is the focus of our study, the government considers these types of programs important policy tool to address extremely poor dietary quality. Health and agriculture extension workers are expected to take a leading role in promoting these types of this program. But this is just one part of a bigger picture. There is also a range of behavioral change communication activities taking place, and the health extension workers are leading in implementing those. So we did a survey in 2017 with more than 2,600 households that had young children. This is geographically extremely widespread, so it allows us to look at the adoption rates across different agroecologies, some of which have relatively better water access, some of them have relatively poorer. We also interviewed the health extension workers. So this is the map of Ethiopia with our surveyed enumeration areas. So you see it's quite widespread, covering different areas, different agroecological zones. So in terms of key findings, we find that 85% of the health extension workers reported that they've been promoting homestead gardens in the last 12 months. 27% of the households reported that they have received these types of promotion, but only 15% of the households actually adopted a homestead garden. When we asked these households that did not adopt a homestead garden, why did they not do so? We find that land and water access seems to be important constraints. And we find that the intensity at which the homestead gardens are promoted in these localities matters. So areas that have high intensity in terms of promotion from the health extension workers or the ag extension workers, they were more likely to adopt. But the water access really comes out strongly here. So areas that have poor water access are much less likely to adopt. And interestingly, if you're located close to a good quality market, you're more likely to adopt as well. Maternal nutrition knowledge was weakly positively associated as well, wealth index as you would assume. But we don't really find associations with land size, so that doesn't come out very strongly in the probit regressions. So then we wanted to look a little bit more carefully on this promotion intensity and how it's kind of how the association differs between areas that have good water access and poor water access. And we find that this promotion is highly positively associated with quite large correlation coefficients in areas that have good water access. But in areas that have poor water access, this promotion doesn't seem to work at all, judging based on these correlations. So in terms of policy messages, the good news is that public extension workers can act as change, sort of a change agents in terms of changing agriculture practices. But you need to have right agroecological settings in place. And I think our results highlight the need for more strategic thinking when it comes to viability and cost effectiveness of promoting homestead gardens in water-constrained areas. And in terms of market linkages, we think that homestead gardens can play a role, if adopted at scale, in reducing the extremely high prices of these products, and thereby that would benefit also the households who are not adopting homestead gardens for various reasons. Thank you.